Good morning. Please permit me to adopt the order of acknowledgments that preceded me, and thank you for the kind introduction, Minister Phillip. To our Prime Minister of St. Kitts and Nevis, the Honorable Dr. Drew, members of Parliament, your cabinet, dignitaries, and distinguished guests. As a partner with the Ministries of Health of St. Kitts and Nevis for over a decade, I am aging myself. It is my honor to chat with you today about how we set a foundation for thinking about violence as a public health issue. Thank you, my old eyes need light. 2 days ago, a 14-year-old in a Georgia high school killed 2 students, 2 teachers, and injured others. On that same day, a young Ugandan woman returning from the Olympics was set ablaze by her boyfriend and died. Violence is a global scourge to every economy and nation. And we can no longer pretend that violence is someone else's problem. Your presence today alludes to your acknowledgement that not only is violence an issue that should be addressed, but also that it must be addressed collaboratively. In the words of my absent colleague, Dr. Isbin Williams, violence takes many forms which converge to erode the well-being of us all and stymies developmental efforts. Stated another way, the impact of violence creates ripples far beyond perpetrators and victims. Think of the students of Appalachia High School who after Wednesday will be counted among those who will never be the same. But where does this problem of violence begin, and what evidence-based interventions are most effective in preventing violence? And then why should violence even be considered a public health issue? I'm glad your Prime Minister asked. To answer those questions, we should begin with a definition of health. The World Health Organization defines health as a comprehensive sense of a person's well-being and the well-being of populations. So it is more than just the absence of disease, but it is support of one's social, physical, emotional, spiritual, and economic well-being. I think we can all agree that exposure to violence disrupts the comprehensive well-being of health. So the next logical question is, what does the discipline of public health contribute to advancing the health of populations? Public health science is a science of preventing disease and injury. Public health entities seek to promote health through organized preventative efforts and data-informed choices of societies, organizations, public and private organizations, communities, and individuals. By definition, public health as a discipline advocates for the collaboration across every sector of society to optimize the comprehensive well-being of citizens through preventative strategies. Targets for public health attention are driven by data that highlights the prevalence, clustering, spread, and transmission vectors of the issue of concern. Prevalence speaks to the number of cases of a focus in proportion to the total population. But that's just the beginning. From there, it must be determined where the issue clusters within the population and where the pockets of highest risk exist. How quickly is prevalence changing within your population? And then how is the issue transmitted from one individual to another? Some of the questions that guide the determination of an issue demanding attention as a public health issue are here. Given the aforementioned definition then of public health, and how as a discipline we define issues of population concern, violence fits squarely in our wheelhouse. By every measure, public health and crime pose a threat to citizen well-being and economies, thus making it a public health priority. Further, violence takes many forms, from the obvious homicides, sexual and physical assaults, suicides, and mortality, to the trauma of verbal and emotional abuse and the vicarious violence experienced by witnesses and families. If there is good news about this subject, it is that education on life skills and conflict resolution at an early age can prevent violence. The Centers for Disease Control state that by understanding the types of violence, we can create actions to stop them before they start. What we in public health also acknowledge is that siloed approaches are ineffective because people do not live in silos. The environments in which children are reared, where people live and work, the community norms, the communities of faith that inform their actions, schools, neighborhood stores, the placement of health centers, accessibility of sidewalks, and even social positioning all act on individuals long before they pull a trigger. In the terminology of public health, all of those factors are social determinants of health. Determinants of health are also our focus because interventions from each sphere of influence have been proven effective in preventing all sorts of health problems. So when we look at the definition of social determinants, we're looking at the context in which people live, work, play, and enjoy their lives. But it also includes the resources necessary to support community development and engagement. So we're talking about policies and services and community norms and adhesion, and yes, also social justice. Violence should be viewed as a public health issue because it shares key characteristics with other health problems and has widespread consequences for individuals and societies. Similar to diseases, violence has identifiable risk factors, such as poverty, exposure to violence, substance abuse, mental health issues, a sense of not belonging and having worth in the society in which you live. These risk factors can be addressed through preventative measures. Addressing violence through a public health lens allows for the development of targeted prevention programs, such as community-based interventions, education campaigns, and policies that address the root causes of violence itself. Viewing violence as a public health issue provides a comprehensive framework for understanding its causes, consequences, and solutions. A public health approach, for example, encourages collaboration between governments and businesses and churches and schools and universities and law enforcement and other community organizations to create comprehensive strategies to prevent violence. By treating violence as a public health issue, interventions then can be designed based on evidence and data and research, ensuring that the resources allocated are reaching their most effective strategies. There is evidence to support that violence can be prevented. However, effectively addressing this complex issue requires collaboration across every sector of society and every person, as well as strategic development of interventions grounded in the idiosyncratic cultures and practices of every nation and community. Boilerplate interventions do not work. We can borrow from them, but they all must be informed by the cultures and the communities that we seek to serve. There is no good data that suggests that the criminal justice system and law enforcement alone reduce rates of crime and violence. Please note, alone. They cannot do it alone. In addition, uncoordinated efforts of well-meaning organizations, agencies have also proven ineffective. Furthermore, commitment to violence prevention is more of a marathon than a sprint. We need to simultaneously be developing and engaging in long-term strategies while we also apply the short-term social band-aids that we experience in our communities. Since the strongest predictor of violence is, in fact, violence, and that violence is often retaliatory and contextual, there is a cycle that needs to be broken. Social norms, for example, about how to respond to confrontations need to shift. The violent act is a manifestation that is fed by complex roots. Those seemingly indirect influences are social determinants of health. It is my hope that I have helped you connect some of the dots in framing violence as a public health issue. I'm a professor and a researcher, but I am also a mother and a grandmother. And on Wednesday again, I was reminded that sending my grandchildren to school, here noted, is an act that could be dangerous. Parents in Appalachia, Georgia, on Wednesday sent their children to school thinking they would pick them up unharmed at the end of the day. As you deliberate today and in the days to come, please consider the world that we are creating for our children, for our elders, and for all of society. While all of us are vulnerable to the direct and indirect consequences of violence, not one of our agencies, ministries, companies, communities, or individuals can effectively address public health violence as a public health issue alone. Change for the better lies in data-driven, strategic collaborations across all sects of society. We can reduce violence in our communities. The way forward is together. Thank you.